Good morning. This is Dr. Mirrafati. Today we have a young lady that is doing breast reduction. She already had one reduction before. Obviously, she wants to reduce it more. I am going to liposuction these areas, not the superiorly so much because I'm going to rely on her having a little bit of sort of superior pull breast there, and then we're gonna reduce the areola again and bring this in like so. She wants to be reduced to about size C. I did recommend a D, but she wants to be smaller. She also doing a lot of fat transfer. We're taking fat from here as well as here and putting it in her buttock area. If you can rotate it so we're putting fat in this area, and we're also lipoing this and sort of taking out fat from here as well. When I do have the fat harvested, I will show you what it looks like. As you know, we always harvest our fat, and then if we need to lipo anything, we do it afterward. I will also show you the progress of the breast reduction. It should be an interesting case. Stay tuned.